I had gotten up for church. We normally go 9 o'clock Mass every Sunday, and usually 8 o'clock or so I'm up. I got up, and I went in the bathroom, got washed up, put my makeup on, did my hair, the whole bit. Came out of the bathroom, and at that point, Bill had said to me, "Are you okay?" And I'm like, in my head, I'm saying, of course I'm okay. I'm looking at him like, whatever. I proceed to make the bed, because I'm not leaving without the bed done. And he had told me, sit on the bench, don't leave. So he comes out, he sees I made the bed. He comes over to me and he says, "How are you?" And I said, I didn't say. My brain said, "I'm fine." So he's like, "Jeanne, where are we? What's my name?" I'm basically yelling at him, "Of course I know your name." It's not coming out my mouth. At that point, he's like, "All right, this is it. I'm calling an ambulance." After they checked my vitals and everything, they said, "Where do you want us to go?" And he said, "She's going to Stony Brook."
Ms. Shore is a 68-year-old female who came in with aphasia, so she had the inability to produce words and speak, and that was recognized by EMS, who brought her directly to Stony Brook. She was scanned, and what we saw is that she had an occlusion of her middle cerebral artery. It was a division of the middle cerebral artery that supplies the left frontal lobe, and the left frontal lobe is the area of the brain that controls your ability to produce speech. So in this situation where an artery is blocked to that region of the brain, that area of the brain is slowly dying, and when brain cells are lost, they're irreversibly lost. Somebody with an occlusion like Ms. Shore had, if we are not able to remove that occlusion and restore blood flow to that area of her brain, it's likely that she would lose her speech function forever. When we went in and did her angiogram, you can see here that she has an occlusion of the M2 segment of her left middle cerebral artery, and is highlighted by this yellow dotted area is the area of brain that's not getting perfusion in her left frontal lobe. This is the roadmap image that we use to guide our catheters up to the area of the occlusion. You can see how we're able to, under this roadmap, navigate our catheters using microwires and the new catheter technologies that we have to get the microcatheters in the position to actually grab this clot and pull the clot out of her head. The microcatheters that we used for her particular case were newer devices that we had access to at Stony Brook, and she was one of the very first patients in the United States treated with this set of catheters, which really expedited our ability to get the clot out of her head and to remove it. So this picture was taken immediately after she was under general anesthetic, and just 5 minutes later you can see her entire brain has been reperfused. And again, because we have this technology here first at Stony Brook, we're able to offer our patients these types of novel treatments with newer devices, which allow us to not only get good revascularization, but get that early. And in her case, because we were successful getting the clot out and reperfusing that brain actually survived, and her speech function was returned totally to normal.
They kept me there for a while, and then they allowed my family to come in and see me and Bill. And my son was saying, "Mom, the doctors helped you. It's going to take a little time. Don't worry. You'll probably get your speech back. You had a stroke." And I'm looking at them like, what do you mean I had a stroke? That's what I want to say. But unfortunately, I said a couple of curse words, and my kids were like, "Hey, she's back. She's back." I was discharged on Wednesday, so within 3 days, 4 days, I was out of there. The nurses were wonderful. The doctors were wonderful. In leaving the hospital, everything was wonderful. And because of it, I was able to celebrate my birthday, which was 1 week later. Who would think I would have had a stroke? I'm a nurse. I know better. I make sure I take care of myself. Thank God I had the procedure there. Thank God I went straight to Stony Brook. They saved me.
For patients with a large vessel occlusion, it is now standard of care that they undergo the same procedure that Ms. Shore got, what's called a thrombectomy. A thrombectomy procedure really is only performed at a comprehensive stroke center, and there are only a couple comprehensive stroke centers on Long Island, and Stony Brook is one of them. If patients are brought to a primary stroke center, they cannot perform this procedure, and oftentimes there are hours of delay before that patient can be transferred to a facility that can perform the thrombectomy procedure. And so in many areas of the United States, they have a direct triage program whereby when EMS recognizes a patient in the field who has a possible large vessel occlusion, rather than stopping off at the nearest stroke center or primary stroke center, they drive the patient directly to a comprehensive stroke center like Stony Brook where we can perform this procedure. That's what happened in Ms. Shore's case, and I'm pretty confident that if she would not have gone directly to a comprehensive stroke center, that likely, even if we were to receive her on transport, there's a good chance that even with successful revascularization, she may not have recovered her speech function as fully or as completely as she has. While there is not a direct triage program that exists in Suffolk County, unfortunately, at this point, it's up to the patients and their families and the EMS providers to recognize signs and symptoms of a severe stroke. And so if you or your family member are having this type of severe stroke, it's within your rights to ask to be taken to the nearest comprehensive stroke center to get the procedure that you need to recover from this stroke.
Why waste time? Don't waste time. Go where you gotta go. I did.